All right, medical emergencies. When and where can medical emergencies or illnesses, trauma, when can they happen? Anywhere, anytime. Hence, one reason those of us in emergency medical services pretty much have to be available 24 hours a day, 7 days a week, 365 days a year. We do a lot of training, a lot of preparing to be available when somebody calls 911 for a medical emergency. Okay. Let's see what else we have on that. First aid. What is first aid? Who can give first aid? Pretty much anybody who has trained as a first responder. Say you have American Heart Association healthcare provider certification. You are trained as a first responder. You can give the initial care to an injured or ill person. That would be first aid. Does that make sense? And next year, hopefully, we'll be able to get some of y'all certified as first responders through the American Heart Association Heart Saver course. First aid could include calling 911, doing CPR, cardiopulmonary resuscitation, or anything else, stopping severe bleeding up to delivering a baby. Okay? That could be the emergency first aid that you have to provide at the scene if you're a trained first responder. Those people who work in emergency medical services that ride ambulances at various levels through emergency medical technician up through and including paramedics, that's their job. They have to know how to take care of almost any kind of emergency whenever they encounter it. It's one reason why I like emergency medical services, because you never know what you're going to get. When the radio goes off, you may get a car accident, you may be delivering a baby, have somebody with a heart attack, go to gunshot wounds, knifings. Been there, done that, have the t-shirt, okay? It's fun. If you don't like four walls and an office, it's a great career to get involved in. A lot of long hours, a lot of stress. Pay is okay, could be a little bit better. Emergency medical services has a lot of career options, including in the hospital, in the emergency room, both as nursing and doctors as well. Now, when you dial 911, calling the emergency dispatch center, a few things we want you to do. We want you to try to speak clearly, speak calmly, provide all the relevant information that you possibly can. How many of you still have a house phone? 1, 2? Most of your folks, like me, gave up their house phone once they got their cell phones and realized that, hey, why am I paying $70 a month to have a house phone that I never use when everybody's got a cell phone, right? When we had regular landlines, you'd call 911. As soon as it was answered by the 911 dispatch center, we would get the location and the name of the person the bill was in and an address. Guess what we cannot get from a cell phone? Exactly. We can't get all that information anymore. It's called Enhanced 911. Maybe at some point in the near future, GPS tracking, those things, they might come up with a system where we can identify where you're at with a cell phone. But right now, the technology, at least at the dispatch center level, does not exist where we can do that. Okay? So you're going to have to tell them, if you're on a cell phone, where you are, so we can get you the care that you need, normally an ambulance, to the right location. How many of y'all live out in the county? Okay, you got the people on the left side of the street, their house numbers are 200. The people on the right side of the street, their house numbers is 600 to 800. Correct? Yes. Been out in the county. Numbering systems on farm to market roads and county roads are not like they are in town. You can't just drive up to 200 Avenue Alpha. I've had to tell dispatchers, okay, well, I'm in the right location. I've got 200 on one side and 800 addresses on the other side. Ask them to flash their porch lights for me to try to find who was calling for me. Seriously, that has happened. Do not hang up the telephone until the dispatcher tells you to. They may give you instructions. If you don't know CPR, they may tell you how to do CPR. They may tell you how to make sure if a person's breathing, has a heartbeat, how to open their airway to make sure that they are able to breathe if they're breathing on their own. So there's a lot of things when you call EMS that happens. They don't just dispatch the ambulance. They do a lot of different things. We had a lot of things about 911 dispatch in Amarillo the last couple of weeks, haven't we? Any of y'all heard about that? Where the interim city manager was staying at a hotel. His key wasn't working when he checked in. He left his bags by his room, came back up, and his bags were gone. Called 911 to get police dispatched out there. He didn't like the way it was being handled, and the police dispatcher basically told him, you know, that's all our other police units are pretty much tied up on higher priority calls right now. That's not one we typically would send a police officer out on. City manager just totally lost it. It's been in the news on Facebook if you follow anything about the city of Amarillo. It's been a pretty hot button topic. It was also discussed in the city council meeting yesterday. There's some city councilmen that want him to resign, don't want to have anything to do with this guy, anymore. He's just interim city manager until they hire a full-time one. It's gotten a lot of press both here locally, statewide, and nationally. I've seen a lot of different news sources. So 911 handles, besides emergency medical calls, police and fire calls as well. Okay. Safety at emergency scenes. To maintain safety and be prepared for an emergency, you guys have to be able to recognize what safety symbols look like. What do we normally have on police cars here in Hereford? What do they look like? Lights? What color are they? Not the lights, the cars. What colors are the cars? No, not anymore. They're black and white, aren't they? Black and white with brand new silver decals. And aren't a lot of them now driving big Explorer type SUVs? They're not the old black cars anymore. They're phasing those out. They're getting the nice new Explorers with they really look nice. Okay? What do fire trucks look like? Pretty much red. Y'all know what the ambulances here look like? White and maroon, correct. What symbols do we have on police cars? Police, do they have the badge on them? What about fire department? They have symbols. Somebody want to catch the door, please? They have cross X and say Hereford Police or Fire Department on it. What symbol do we have on the ambulance?
Is it the snakes that are...
The snakes, yeah. It's called a what? It's called the Star of Life. You're thinking of the caduceus, which is the medical symbol. You have to be aware of that one as well. That's the caduceus right there. Do I have one on my back? Okay, that's the caduceus. Star of Life is what we normally see on the ambulance. And a funny fact, there is a 3 to 4 foot blue Star of Life on top of the ambulance. Why? Why do you think we have a 3 to 4 foot blue Star of Life on the top of the ambulance box? for the helicopters to see them if we have to call in a helicopter and we're not, at a location like a hospital or a healthcare facility, if we need them to come in and evacuate somebody out. Interesting stuff, huh? So most emergency services are defined by their colors. There's some emergency signs. Are you aware of each and every one of them? Red stands for biohazards. Things that are contaminated by blood or body fluids. Fire safety. This sign right here shows us an AED is present. This one, wash your hands. Is it important to wash your hands?
Yes.
What is the number one way to prevent yourself from getting infected?
Not washing
Yeah, wash your hands. Wear gloves too. What is this symbol?
Handicap.
Handicap. And this one?
General safety signs.
Just general emergency stuff. You need to be aware of the signs, okay? Bioterrorism. Nuclear, biological, and chemical warfare. Nuclear bombs, chemical agents that can be weaponized, put in bombs, gas canisters. Have we seen them been used anywhere recently in the last few years? Have you heard of it being released in northern Syria? Has been. Been reports 20, 30, 40,000 people that are against the present Syrian government. There are some reports that the Syrian government has used chemical weapons on some of its populations and some of the people who are rebelling against the current administration there. Do you think that's pretty serious? Yeah. Do you think nuclear, biological, and chemical weapons can affect a large amount of people in a small confined area? One reason they are so effective, one reason they're predominantly outlawed by most countries nowadays under the Geneva Convention. World War I, my grandfather fought in that. They used to use mustard gas, and so many people came through his field hospital that had been gassed and had respiratory problems. Some people even died from exposure if they got enough exposure to it. But some people had lifelong respiratory problems afterwards. Does that get a little scary? Now, is terrorism a fact that we live with? Yeah, could that happen anywhere at any time in the United States right now? Recently, what do we have out in San Bernardino, California? Shootings. What if somebody got a hold of some of these weaponized nuclear, biological, or chemical agents? Do you think that could get really crazy really fast? What if they unleashed it in New York, San Francisco, Washington, D.C.? Could that affect thousands and even hundreds of thousands of people? What if they contaminated the water supply? This is something that should concern you. You should be aware of it. Because if that happens and you're a healthcare worker, how many potential victims or patients could you have? A whole bunch of them, guys. Do you think it'll overwhelm the resources we have available? Could it possibly? Sure could overwhelm the resources that we have available. I am telling you. We've got to be really responsible to know how to respond to these bioterrorism acts, because they are potential for us to really run across in this day and age. We see it happening in other countries almost on a daily basis, right? Especially over in Eastern Europe, around the countries of Afghanistan and Iraq. Do we see a lot of bioterrorism? Sure do. Something we have to be aware of. Healthcare facilities should have emergency plans for dealing with bioterrorism. We should also have shelter-in-place procedures already established. If something happens, we're going to try to remain as safe as we possibly can so the healthcare workers can help everybody out. And we can also protect the patients that we have in our facility at that time. And then get ready for the onslaught of goodness knows how many patients we possibly could get. Okay? So, bioterrorism, it's something that we have to live with, we need to be aware of, and we need to be prepared for. Now let me ask you a question. Does anybody know what CPR is? Tell me, what is it?
Do you have to do chest compressions?
Chest compressions, okay, that would be for cardio. CPR, cardiopulmonary resuscitation. So what are we going to do besides chest compressions? Breaths, rescue breathing, right. When a person has their heart stop, either because of a heart attack or another process, we can circulate the blood and put additional oxygen on the blood by doing CPR. That's something that a little later on in this chapter, what we're going to do is we're going to actually pull out some CPR mannequins and go through some of the actual steps of doing CPR. I think the answer is you're going to see is going to be a series of ventilations and breaths and chest compressions used on a person who has stopped breathing or whose heart has stopped. Okay, let me shut that off because that's all I want to record